This information is for educational purposes only. It is not intended to substitute for professional medical advice and should not be interpreted to contain treatment recommendations.
Start by washing your hands thoroughly with soap and water. Remember also to wash your thumbs. A hand sanitizer can be used if you don't have access to washing facilities. Make sure you have all the equipment you will need before you start to catheterize. You will need a catheter set, sterile wipes or soap with a neutral pH value, and water to clean your penis. A drape and a device to hold your legs apart may also be useful. Pull your clothing down. You may use a device to hold your legs apart or to hold your clothes out of the way. To avoid wetting your clothes, you may place a drape under your penis. To prevent pushing bacteria into the urethra and bladder, you must first clean the head of the penis properly. Gently pull the foreskin back and wash the head of the penis. To remove any bacteria that might be present at the opening of the urethra, you should clean your penis, starting at the urethra and working outward. Use each wipe only once. Twist to open the tube and remove the lid. Unfold the bag. Twist and pull the catheter out of the tubing. Now it is ready to insert. Make sure that the catheter does not touch anything before you insert it into the urethra. If it does, discard the catheter and use a new catheter. A catheter that has been in contact with the sink or your skin may be contaminated and could potentially cause infection. Hold your penis pointing upward and toward your stomach. This will ease the insertion of the catheter as the natural S shape of the urethra is changed into a U shape. Provide a gentle pressure to the head of your penis in order to open up the urethra. To help insertion of the catheter, it is important that you relax. Slowly and gently insert the catheter into your urethra. You may feel some resistance when the catheter is passing the prostate and the sphincter, so be gentle. Insert the catheter until it reaches your bladder and the urine starts to flow. Insert the catheter about 1 inch further and hold it there until the urine stops. When the flow stops, move a little and straighten yourself up to make sure that the bladder is completely empty. Withdraw the catheter slowly to ensure that you drain any remaining urine at the base of your bladder. With some force, push the catheter back into the tubing and reseal it by turning the catheter clockwise. Open the urine bag by tearing off the tab and empty it into the toilet. Twist the bag around the tubing and replace the lid. You can dispose of your catheter set in your household trash. Do not flush it down the toilet. Wash your hands, and you have completed the process. Important note: the catheterization procedure must always be carried out under guidance from a healthcare professional. The instructions provided in this film are only intended as follow-up to the advice you have already been given.